Hello, everyone. My name is Peter Rice, and I'm the Chief Operating Officer at PharmaCCX. We leverage technology and data to help pharma and payers seamlessly manage their entire price negotiation, rebate, and deal management process for complex access agreements. Today, in our next installment of Contingently Committed, our video series where we interview experts in our field to learn about the latest advancements at the intersection of technology and pharmaceuticals, we're going to talk with my friend and PharmaCCX's board member, Julia Bernstein, who is also the GM at 30 Madison. Julia, thank you for joining us. I know you bring a real wealth of knowledge in the healthcare strategy space, and I'm excited to talk to you more about it today. So tell us first a little bit about your background.
Yeah, absolutely. First of all, Peter, thank you. I'm always excited to talk about healthcare and PharmaCCX in particular. So by way of background, I've been working in and around the digital health space for most of my career. I've spent some time at early stage startups, primarily in the behavioral health space. So Ginger, back when it was Ginger.io, and Tempest, which is an online alcohol use disorder treatment program. I've also spent some time on the health insurance side working at Beacon Health Options prior to the Anthem acquisition. And currently I'm the general manager of our platform at 30 Madison. 30 Madison is a specialty care provider that offers an integrated care model for those who are struggling with chronic conditions. And I manage all of our shared services, our medical group, our customer care, our pharmacy, our payer contracting. So all the nitty-gritty elements that make things work. And in addition, I'm an advisor and investor to a number of early stage startups, and I'm honored to serve on the PharmaCCX board.
We're all obviously excited to have you on as part of our team. So obviously you're in the healthcare space and very aware of everything going on. And so curious on your kind of what's changed in the last 18 months with the pandemic. And I'm sure there are some obvious answers, but also curious kind of what are some things that might be a little bit less obvious as to what might be changing.
Yeah, so I think the kind of prevailing wisdom is that we've seen like 10 years of technological innovation in, 15 months in the healthcare space. And I think in my world, the boom of digital first care and direct to consumer healthcare has been really, really interesting, as well as I think the role that technology has played in speeding up drug delivery and vaccine delivery more on the PharmaCCX side. I think for me, the most interesting shift, and this has been coming for a while, and I think the pandemic exacerbated a little bit, is the shift around healthcare consumerism. I remember when I was back at McKinsey, 15 years ago, we would do this report on, consumer insights in healthcare. And the big takeaway was that people didn't think about themselves as consumers or payers for healthcare. They thought about themselves as users. And I think with the pandemic and with people needing to take more control of their healthcare, as well as the rise of all of these direct to consumer and kind of customer first healthcare companies, you've seen that shift so that people now do think about themselves as consumers who have choices when it comes to payment and prices for healthcare.
Yeah. Do you think the same change is happening kind of on the government side within the US? Obviously, are they starting to think a bit more as consumers and payers, or is that change maybe going to take longer to happen?
That is a good question. The thing with government care in the US is it's so specific. You've got the VA, you've got Medicare, and then all of the delegated Medicare Advantage plans, and you have Medicaid, which is a state-by-state program. So you're seeing some of the more progressive states doing more interesting things, but I think it's hard to make a blanket statement on the government side in the US.
Yeah, there's definitely been a lot. I'm just reading today about kind of some pushback on some of Biden's plans, but it'll be really interesting to see. I think certainly from our perspective, being at this intersection where we're a US-based company, but doing business in Europe, I think we get to see both sides of that. So.
Yeah, absolutely.
So obviously you said you've both worked in the healthcare space and you've invested in some companies and advised several of them. And obviously that's a kind of a huge boon to them. But what are some of the traits that you see that make healthcare companies able to succeed?
Yeah, it's a really good question. I think the companies that I've seen succeed understand the way the dollars flow in healthcare. I think there are a lot of really good ideas in healthcare that don't have a good sense of how that idea is going to be paid for and who benefits both in terms of clinical effectiveness and financial outcomes for the service. And so the companies that I've seen do really well kind of have a hypothesis on where the money is going to come from and then have a very clear plan on executing, especially knowing that a lot of the time to get paid it's a long sales cycle, especially if you're in the B2B world or working with payers or pharmaceutical companies or health systems.
Yeah, it's a fascinating industry that does not like who gets the benefit, who's paying for it, who gets some of the financial benefits is very complicated. Yeah, interesting. Kind of along those lines, just kind of looking at the healthcare and pharma space in general, what are some trends you see kind of longer term, maybe not just related to kind of response to the pandemic, but just where things are going as we move forward?
Yeah, it's a good question. I mean, I think this healthcare consumerism is a big piece. I think what I'll say to everyone is every company right now is a D2C marketing company, even if you don't get paid D2C. Because let's say you're working B2B, you still need people to use your service, your drug, your product. And that generally requires marketing yourself, not only relying on the payer to market. I think we have seen a relaxation in some of the onerous regulations that have made the delivery of care difficult. I think we'll see some of that walked back now that the pandemic is over, but I think a lot of that is here to stay. And then I think just one of the big trends I've seen is the excitement around healthcare. When I started in the digital health space back in San Francisco in the early 2010s, we would joke that there were 70 of us and we could all fit in a bar for a happy hour. And now it feels like everyone I know is in healthcare and there's so much money coming in. So I think the focus on healthcare as a place where you can do good and also do well is really exciting.
Yeah, there's definitely, and not only people who are directly involved, but I think this is one of those outcomes of the pandemic is everybody now cares a lot more. We're all aware of what does public health mean? What are all these institutions that kind of are tied to healthcare and how do they fit in?
Absolutely.
Kind of along those lines, what do people misunderstand about this industry? Now that everyone's an expert, or at least an epidemiologist, kind of what are other things that people maybe misunderstand about the healthcare industry?
I think it's less a misunderstanding, but I think, a little bit of what makes this industry so difficult is just the complexity. Yeah. I think it's really hard to kind of wrap your head around how it all fits together and the nuance. And so I think there's a lot of potential for people to come in and say, this should be really simple. I should be able to offer service X, get paid Y, have outcome Z. And it's a lot more complex. I think the flip side of that is there's benefit in having people who kind of step in from outside and look at this and say, this is bananas. How do we cut the red tape? How do we do things differently? So I think, the complexity is both a barrier, but having people who are unfamiliar with it can also be an opportunity for change.
Yeah, for sure. I think it will be interesting to see over the next decade, maybe less time, just kind of all these outsiders looking at the healthcare space and how they might be able to make a difference. Well, any other kind of high-level thoughts on the healthcare space, things that kind of are tickling your brain as you think about this space?
And the other thing I'll say is I'm really excited about the rising focus on infrastructure. I think PharmaCCX is a great example of a company that works in the background, creating better piping and data exchange. And so we're seeing this a lot on the care delivery side right now, and it's a lot of where I'm spending my time at 30 Madison. But I am really excited about people's recognition that in order for these services and care to work more effectively, we just need better piping and infrastructure on the back end.
Yeah. Do you have a thought on, I know just another space I've worked in the past, kind of the energy space, there was this notion of kind of having all your data available. Is there one place to look and see where's energy being produced? Where is it being used? Do you think there's going to be some big, massive healthcare data system in the US or kind of it's right now is very fragmented and not complete. Is that something to achieve, to strive for, or is that a pipe dream that's never going to happen anyway? We need to learn how to work our way around it.
I think it'll happen at some point. I think this idea of the universal record where, I give you my name, I get the experience style, did you live here? And then I don't have to complete an intake form. You have all my health information. I think that's, something that people are really excited about. You have a lot of kind of public entities working on that. And then you're starting to see the rise of new private companies that are trying to do this. And, the language of services and APIs and databases and infrastructure. So I think we will get there, whether it's a public initiative or a private company or multiple private companies that have to figure out how to work together. I think time will tell.
Yeah, it'll be kind of, it's so important for us to get there, to at least have a common language, as you said, to talk about this, but kind of how to get from here to there is it'll be an interesting path. So
absolutely.
Well, this has been great, Julia. Really appreciate it. Kind of, obviously, our company is focused on contingent commitments, and this series is called Contingently Committed. So, wondering if there is a contingent commitment in your life as an example that you can think of kind of how you think about that.
It's very top of mind because we're in the process of buying a house.
Yes.
So, doing the contract and the mortgage. I feel very contingently committed right now in a lot of places. So if you want to talk about an industry that's ripe for disruption, happy to talk about the mortgage industry.
Yeah. I agree that and realtors, it'll be interesting yeah. Well, hopefully congratulations soon on the new home. I hope that works out.
Hopefully.
Yeah, kind of. And good luck with the move and all that. But thanks again for your time today. Really appreciate it. And I'm sure we'll continue to talk and hear good ideas from you in the future.
Yeah. Thanks again for the time, and great to catch up, Peter.